Welcome to the Green Wisdom Health Podcast with Dr. Stephen and Janet Lewis, where you will learn about natural solutions to common ailments. And now, here are your hosts, Dr. Stephen and Janet Lewis.
Hello, and welcome to this week's edition of the Green Wisdom Health Show. I'm Janet Lewis.
And I'm drinking coffee.
And that tells you that he's wide awake and ready for today's show about brain health. This one's called Tips for Optimum Brain Health, and apparently coffee's one of those, Dr. Lewis?
Mm-hmm. Well, caffeine, you can read research that says anything you want. I choose to read the ones that say caffeine's a good thing, in moderation, though.
Well, we have so many people suffering from dementia, Alzheimer's type issues, brain fog. Today, Dr. Lewis is going to explain the difference between some of those and some of the different nutritional products that you can take for it. Some of them you've probably heard of. Some of them you might not have heard of. If you've been hanging around us very long, you've probably heard of most of them.
Yeah, but if you don't remember them, then you really do need the help for brain.
Oh, that's true. And then there's a lot of people have cardiovascular issues that have brain issues, right?
Yep.
So can you explain today about, because that's a scary thing when you start getting older and you totally lose what you were going to say, what you were going to do, what you came into a room for. We hear that all the time. It's like I walked into a room, don't know what I went in there for.
Hey, it's the bathroom. Take a hint.
Yeah, there you go. And and you're trying to figure out where did it go and when did that happen, because as we age, things start changing. So, Dr. Lewis, today, would you give us some hope and tell us whether or not that's something that is possible to bring back? Is your mind?
Well, yeah, it's really not about age as much as it is about accumulation of toxins or the glycation that creates aging. And, I always have my opinions, and, I always ask that you listen with a spirit of discernment. Worst thing you can do, I think, is, eat sugar or simple carbohydrates that turn to sugar, basically grains, but grains and carbs, for the most part, set fire to the brain, which is fire would be inflammation. It surges into blood sugar, and it has a pretty bad negative effect on the brain. The inflammatory cascade, you've heard the term cytokines or cytokines that are bandied about. That's a normal inflammatory marker, but it can be too much and too prolonged, which causes all sorts of problems. So when your blood sugar increases, there's a depletion of neurotransmitters of serotonin. Serotonin's the one that's used for mood, weight loss, and what is it? Sleep. Deep sleep. Sorry.
He had a forgetful moment. Is that what that was?
Yeah, I do that. Epinephrine, norepinephrine, GABA, and dopamine. And, we didn't say stress, anxiety, and depression because of all the stuff that's being thrown at us, most of which is not true. You know the truth. That's the one that's being censored. But just sugar by itself can do that, and the simple carbohydrates. And that also lowers your body's ability to have an immune system response with the white blood cells and the types of white blood cells. So the more you do simple carbs and sugar, the more prone you are to catch diseases. I'm trying to be so careful here, folks. And so all these people are believing a bunch of the nonsense that's thrown upon them. Let me just back off. Are
you saying stress is a cause of the brain not functioning correctly?
I've had 2 days of saying something that made Janet spit her coffee out. So let's go for number 3. Some of the people that's throwing rules and regulations at society, if they got 1 IQ point dumber, you'd have to water them twice a week.
Well, that is good.
We won't talk about 1 or 2 of the other things I said that made Janet spit her coffee out. But as you do sugar and simple carbs, it decreases all these neurotransmitters that make us happy. To have the transfer of these neurotransmitters up into the brain, you have to have B vitamins. Janice got the, where in the heck are you going with this look, or she lost something?
No, I just realized I forgot something. I'm thinking, oh my gosh, what an appropriate show.
Well, we're having fun. That's the key.
Yeah, we are. I thought it's just gone. I don't know where it went. Anyway, and there's been a little stress, because stress also causes you to not have your mind correct. And my husband has kind of thrown me in the middle of some of this. We're in the middle of moving, actually, this week. And
again?
Yeah, 6 months ago we did it, and now here we are again doing it because he found a house he liked. So we're going again, and and this week we're doing that. So forgive me if I have little blank moments.
So I tell Janet, I said, I've made your life exciting. She said, there's a difference sometimes between excitement and enjoyment. I said, well, buckle up, honey. Let's go for a ride. So, to help your brain, the cognition, you have to stay away from sweetened beverages, anything that's grain-based foods. Yes, I even gave up beer because I never drank that much beer anyway, but I love Shinerbach and Ziegenbach, two good Texas beers. But you stay the heck away from pasta, cookies, cakes, bagels, and other seemingly whole grain bread. People say, well, what about Ezekiel bread? And I told this preacher of a huge church, I said, although I know it's the holy bread Moses carried across the desert for 40 years, it's still grain, and that's why you still got a belly, and that's why you're losing your mind, and you're only in your late 40s or early 50s. So,
see, is that yeast then? Yeast will create you having...
Oh, good one. Yes, it feeds yeast. And I tell these people, well, if your eosinophils go high, you have the probability of having too much yeast, and yeast do something. You've heard me talk about it before. It steals your thiamine. It puts out an enzyme called thymidase, so you can't get your thiamine. What is thiamine? It's B1. And if you have low B1, which you don't get that much out of your diet anyway, that's why you have to supplement with good stuff. Most stuff is not good. But it steals your thiamine, you get brain fog. So if you got brain fog or those dementia moments.
Has that been photamine?
Yeah, that's a fat-soluble one, and many people call me, email me within 2-3 weeks and say, holy jeez, my brain fog's gone. I said, well, tell your husband, buy me chocolate and flowers. Used to, I'd say chocolate and Shinerbach, but I quit drinking that. But you can get it back, folks. Most of these old age things are not old age. It's something you can have control over. If you're a carboholic, quit. Go paleo, primal, keto. I like keto best. Clean keto is better than dirty keto, although dirty keto will do the job, and I'm not talking about dirty dancing. It's not a romantic thing, folks.
But type 2 diabetics are probably, if they're having memory problems also, many times that's caused from yeast, and many times it's caused from the medication that they're put on as well, because it seems to suppress memory function somehow. We have a lot of diabetics that have really poor memory.
And that's the high blood sugar, the glycation. Diabetes, according to one study, it tripled. See, I forgot. It tripled from 1980 through 2011. It tripled, folks. Well, it's 10 years past that, so what's it doing? And it's like, well, if you'll get the holy heck off of corn, soy, and wheat, and other things, but that's the main thing, get off of that, your whole life can change, and that will help you with weight loss.
Which is stress, which is your cortisol.
Yeah, the high inflammation. If you're 10 pounds or more overweight, you've got too much inflammation. It's an inflammatory cascade.
And another reason why you may not have great memory is because you're not getting enough sleep. If you got 8 hours sleep a night, but it took you 4 days to get those 8 hours of sleep, you might not be getting enough sleep.
You might be a redneck if.
Right. So therefore, you don't really have great memory whenever you're not getting enough rest. And there are products that can help you with that also. We have a lot of people that, I can't tell you that people tell me, I take some NyQuil before I go to bed because I need to rest.
Or I drink a half a bottle of scotch. It's like, oh, good Lord.
So then your liver is all upset because that's when it repairs itself, is usually between 1 and 3 in the morning. And inevitably, the people go, yeah, that's usually about the time I wake up, and then I just can't go back to sleep. Well, it's like, well, you've just set the liver on fire, literally, with either one of those two things. So consider things like liver support and detox or something like that that helps calm that down during those hours, look at the Chinese body clock on Google, and you can see what hours different organs are having problems. And then you'll know which organ to address. If you're awake during those hours, what's causing you to be awake, and then your body's trying to give you a signal. You don't just drug it with something, hoping it's going to go away, because all you're doing is making the problem worse. Go ahead. I know you have something to say.
Yeah.
I hope it's something you can repeat, but go ahead.
No, it's really not. Sorry. It's one of those days. People say, well, my wife's had 2 strokes. It's like, well, what are you doing about it? You've got to change your diet. And I ask people now, I'm getting more blunt and bold as I get older. It's like, are you willing to change your diet? And they say, no. I said, well, don't waste my time. And I don't mean to be disrespectful, but I got too many really, really good people out there. I could name off dozens right now off the top of my head, from Maine to California and, Florida up to Washington and Oregon. One of the things, if you've had a stroke, and I take things just, nutritionally to help my body be stronger, you need to be taking what, we have something called Optimum memory, and there's a lot of things on it that are really good. It's a really brilliant combination. It's got ginkgo. Like George Carlin used to say, if you can remember to take your ginkgo, do you really need it for your memory? Well, yeah. It helps to stimulate the release of NOS, which is nitrous oxide, which increases cerebral blood flow. Now, most men know that arginine does the nitrous oxide, and they like it because it engorges places other than their cerebellum. Well, carnitine works better, I think. Citrulline works better, I think. We'll talk about carnitine in a minute, but the ginkgo is really, really good. It's been shown to support memory in both in animals and humans, and some humans are animals. So it helps the cognitive effects, which is a good thing. Another compound that's in it is called vinpocetine, and I love that stuff. And I've had some people that have inner and middle ear issues and tinnitus that it can actually go away because of the increased vascularity that vinpocetine can afford you. Now, if you've got the tinnitus, you need to go see somebody that specializes in that, because it can be other things too. You always want to get 2 or 3 different opinions. Some people think this is the only thing and they'll never do medical care. It's like, medical care is a wonderful thing. You need 2, 3 different opinions. Even if we fix it, just because you have a headache doesn't mean a chiropractic adjustment always fixes it, even though it can, or good nutrition that gives you more cerebellar vascularity. It may be something the medical profession needs to look at. It can be something like tumors. But the other ingredient in this that is not very common in America, but I've been using it for about 30 years, that's why I have a pretty good memory, is called huperzine A, which the A stands for alkaloids. That's very, very common in Japan, and they have much less dementia and fewer strokes in Japan. And that may be also because of diet changes and societal issues also. But huperzine A, it's been shown or proved to have improvements in memory, cognitive function, and behavioral function. So when I'm a little bit crazy in my behavior, maybe that's what Janet's given me. I don't know. She gives me stuff and I take it. It may be to calm me down. I don't know. But it helps with your memory quotient. It's a good thing.
Well, then one that you guys have probably heard us talk about a lot, we give it to you many times because of your lab, your triglycerides are too high on the lab, is fish oil. But there is a difference in the fish oil. It's the amount, for us, it's the ratio of EPA to DHA that actually makes it work. And our Omega Supreme has a very high ratio of that. But that's also got a lot to do with brain health, right, Dr. Lewis?
In a big way, the good fish oil is incredibly anti-inflammatory. And I tell people ours is 293% more absorbable, although I was looking for something in my drawer a while ago, and I found assay that said it was 393% more absorbable, and it's cleaned up. There's fish oil is kind of like women,
I can't wait to hear where this is going.
No, I've already cleaned it up. It got caught in my filter, but some of it's much better than others. And yeah, fish oil is good. Janet gives me a double dose. She says, this is for your brain and for your heart. And it's like, you don't care about anything else? She said, well, if one of them goes downhill, the rest of you doesn't matter. It's like, wow, I don't know whether to be flattered or insulted, but she gives me a big dose of fish oil every day.
Well, and for people that have cardiovascular issues in their family, or they know if you don't know if they do, if people that have had heart attacks, strokes, dementia, Alzheimer's, you've got cardiovascular problems genetically, fish oil is a must for those individuals to help stave away the Alzheimer, dementia type symptoms, right?
Yeah, and get started before it becomes evident. And if it doesn't show up, how do you know you prevented it? It's, well, it doesn't matter. You've taken it. And like I told, I've said the story about I paid $108 to get my oil changed in my truck, and Alan from Maine, love that guy, he says, I never thought, it ever cost that much until I had the oil changed in my truck, and since he'd gone to diesel, he understands why it costs over $100. But one of the things that I don't talk about enough is something called acetyl L-carnitine. Now, acetyl L-carnitine is, they call it an amino acid. It's not really exactly that. It's more related to the B vitamins, so to speak. But it helps long-chain fatty acid transport, which helps burn it in the mitochondria. And remember from a previous podcast, we talked about mitochondria being the energy-producing engine in the cell. So, carnitine is super, super good for your heart, but it's incredibly good for your memory, for your brain. It increases the use of fat as an energy source. So if you're doing keto, you really ought to be doing the acetyl L-carnitine, but it helps prevent the fatty buildup, especially in the heart, the liver, and the skeletal muscles. So I've had some people just got on that and started losing a little bit of weight. Yes, you need a little diet change with that. Stay the heck away from sugars and carbs, especially the simple carbs. It's good for chronic fatigue syndrome.
It's good for depression.
It's good for memory, but I forgot. Okay.
It actually helps improve a condition in patients called degenerative cerebellar, I can't say it. Cerebellar ataxia, which is a condition resulting in the loss of control of bodily movement. So if you have someone that's having a hard time, I guess that would be with extremities.
Yeah, well, that would include Jimmy that was on the podcast earlier about the myasthenia gravis.
Autoimmune type things.
Yeah, and loss of muscular function. That's why he fell off the RV to start with. And yes, I have permission to talk about Jimmy, so yeah, I'm cool there.
Yeah, so
carnitine reduces fatigue, which is common in many, many diseases, especially like the autoimmune that Janet just mentioned. To enhance the effectiveness, you need E and C, and both of them don't get a lot of press like they did a few decades ago. It has to be a good one. There's way different. Most of the E on the market's synthetic, so not only does it not work, but your body has to use energy to synthesize it and detoxify it. So carnitine is really, really good. And we'll get off the subject of brain for a minute. And I take a lot of seminars as well as read jillions of books, dozens and dozens and dozens per year, and thousands of research articles I read till late in the night usually.
And that's actually supposed to be another sign of keeping yourself really good with circulation, is learning something new.
I thought she just thought it made me sexy, but I was taking a seminar and the guy said, well, the average man's sperm count is around 40 million. Used to be 100, and we're getting less and less masculine. I'm not allowed to say the term soy boy on the podcast because Janet and Brandy said that would be offensive, so I can't say that. But the man's sperm count is down to about 40, headed toward 30, and at 30 you're considered pretty much totally infertile. And I had a lady the other day talked about infertility, and I said, well, you've got to address your husband's sperm count, which was 17 million. And people say, well, it just takes one sperm to impregnate the egg. And it's like, yeah, but it takes all the enzymes on the other ones to allow that to happen. And acetyl L-carnitine and good vitamin E is really, 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 really good for that. So
really, it uses part of the other
enzymes. enzymes.
Really?
Yeah.
See, I didn't know that.
I'm an expert.
I'm learning sign language from my granddaughter, so that's how I'm exercising my brain. She teaches me all the way from Germany because our son serves in the military, and so we video chat, and she teaches me sign language, so keeps my mind active.
I keep her mind active by saying things that makes her spit her coffee. People that are vegetarians and vegans are less likely to have carnitine, or they're more deficient because it's not found in vegetable protein. They'll say, well, this has as many grams of protein as a ribeye steak. It's like, yeah, well, just because it's a gram of protein doesn't mean it's the right profile of amino acids. So don't fool yourself into thinking that's really sufficient.
Another player in the game is B12, vitamin B12, because it actually a lack of it will wreak havoc on your cognitive functions.
And your ability to pronounce it.
Apparently so. Mental fogginess and problems with memory are the top 2 warning signs that you have a vitamin B12 deficiency. And it's indicative of its importance for your brain health. But there's a difference in vitamin B12s as well, right? Or is that just...
Yeah, most of them on the market are bad. They're cyanocobalamin, and people can take large doses and continue to be very deficient. And then they'll get into the vitamin B12 injections, which is not necessarily a bad thing, but I'd rather get it through the stomach, which is the way God intended for it to get in and to be utilized. But that's me. And people with low liver enzymes, if it's not the beginning of fatty liver, it's usually a B6 deficiency. And B6 is pretty super duper important in the utilization of B12 as well. And when I'm talking about these things, we're talking about the production of neurotransmitters. The main one is acetylcholine, which is a neurotransmitter that really assists in memory and learning. So B6 is really, really good, and I tell people, and this is always simply put, but if you're low in B6, it usually shows in your low liver enzymes, and you cannot allow the neurotransmitters to cross the blood-brain barrier because you don't have enough B6. And then you get into the folate issue. Half of us have that 5-MTHF-R deficiency. I have 2 of the worst ones. Janet can tell when I don't take that because she says I'm not as happy, and it's like, I'm always happy. And she said, well, you're not as happy and energetic. Hang on the word energetic, because if I don't take that particular type of 5-MTHF or folic acid, specialized form, I can't utilize the B6 or B12 to create energy. So pay attention to that, folks.
So are you talking about the methyl supreme, the one?
That's the one I like the best. We have a B12 folate plus, which is really, really, really good. The only difference between the two is methyl supreme has the riboflavin.
And then if people are new out there listening and saying, oh my gosh, there's just so much stuff, I think that's why sometimes we get people that really want to do everything that we mention, and they do. We love you guys because you're so willing to try that. But there's people out there that go, well, I just want to take one product. We have a formulation of a multivitamin that Dr. Lewis will always say, well, just take this multivitamin if you're not going to do anything else. It's kind of got a little bit of a lot of that stuff that you're talking about, right? The active mega multi too.
Yeah, it has the right type of B12, B6, the right type of folic acid. And it has good ratios in it, and it covers a multitude of sins. And one of the mistakes that we make as a society is saying, but I feel good. It's like, number one, you may have cancer in there for 20 years. You may not feel it. So your feelings, although that's important to me, that doesn't get to have the entire vote. And sometimes what you think feeling good is something that your body was dumbed down over a period of months or years, and it's just normal to you, which is really not normal. That's become common. So maybe you just don't remember what feeling good really is.
I always like your analogy of what you tell a lot of the men that come into our store here, because you'll have more women generally that are willing to take more things.
That's why y'all outlive us 7.8 years on the average.
But men either don't want to do it or they want to take very little. And Dr. Lewis is famous for telling them, you take better care of your truck than you do your body. And you're thinking, well, if you think about that, it's like, well, I feel good. I don't need to take anything. Your truck will run too like that for a while, right?
Yeah, but what if you could get an extra 100,000 healthy miles out of your truck?
Yeah.
You know, I'm like this, and people say, well, why do you do this? I said, because I know what it's like to have a daddy that died early when I was 15 years of age, and I'll be damned if I'm going to do that to my kids, and I passed that anyway. Now I got grandkids. Holy cow, what a blessing, and it was worth hanging around for. And there's so many people that listen to us and just follow instructions. Like my friend Debbie out in Midland, we grew up together, and she just follows my advice. And it's like, it's hard to follow Dr. Lewis's advice when you grew up and he was Stephen. The things I did in high school, I apologize.
I'm sure you were one of the smart ones in your class at that time, too.
I was smart, but I was a little disruptive at times. I threw Barbara out the window, literally. That's back before air conditioning. Me and Steve threw Barbara out the window and closed the window and made the English teacher cry, which I did apologize to her. But I was always having fun. Again, sometimes excitement is not necessarily enjoyment, so you have to properly define that. So some of the things, you know, I want to make sure we talk about glycerophosphocholine. I'm going to get to that. But some of the things for brain health, and folks, get going before it's obvious that you need it. Arginine, which I told you about, but I think carnitine is better. I really do. Essential fatty acids, which Janet talked about in the officials, it reduces brain inflammation. A 20 to 40% decrease in Alzheimer's has been reported with EFAs, essential fatty acids, and that's from Journal of Annals of Neurology, American Journal of Clinical Nutrition, Journal of Lipids. I mean, we're talking about high-class research, people. Cobalamin, which it needs to be methylcobalamin, that's New England Journal of Medicine. High-protein diet helps neurodegenerative diseases. High protein, it didn't say high carbs. The higher the carb, the sicker you're going to be. And even if it doesn't decrease the amount of life you have, it's going to decrease the amount of life in your life.
Yeah, and then you do need to talk about our GPC. I actually saved the best for last. It's the one you can actually tell your brain is better very quickly on. If you think that you've tried all kind of things, you can't tell. You can tell. You do. This isn't a liquid form. It tastes good. It tastes sweet. There's no bad taste to it. You do, as an adult, need to do 2 dropperfuls of it at a time.
Not that I don't do 4 sometimes.
We tried to be conservative and go, well, you know, because it's a little bit pricey.
So it's Alzheimer's treatment, too.
Well, I know. Well, compared to most products, if you're just trying to get started on something. But we tried doing it at 1 dropper to see if it could last longer, and you could not really tell. No one could really tell at 1 dropperful, so we told them to go to 2 droppers. Every one of us can tell a difference in it within a couple of days. And
we have stuff that has phosphatidylserine in it, and that's a good thing. But GPC, glycerophosphocholine, is way, oh my God, it's the big dog. Mm-hmm. It helps with muscle function. It helps with growth hormone production. It helps improve memory. It helps improve focus. Reaction time gets way better in the elderly and young individuals. Boost the acetylcholine that I talked about earlier, which helps release it to the neurons and probably from the cells itself. Helps compensate the acetylcholine decline due to aging or estrogen deficiencies. Yeah, menopause. Men, just be tolerant. Don't say a dadgum thing when your wife goes through menopause. Stay quiet.
And you'll stay married.
Yeah, well, you may stay alive. You know, if she, you know, I watched The Burning Bed. Improves the mitochondrial function that I talked about, which means increased energy. Brain repair and Alzheimer's dementia support. It helps brain recovery from stroke. And again, I take the Optimum memory. The dose on that's 1 a day, so I usually do 2.
My 86-year-old daddy takes the Optimum memory, and he takes the GPC Liquid. And it's like he's 50 again. I mean, his mind is still, and he's got energy.
His memory came back, and it was gone bad enough we could tell a huge difference very quickly, too. The GPC helps reduce Alzheimer's-like brain volume shrinkage. One of the things you've got to understand, though, GPC helps support sperm motility. Well, I talked about that with the acetyl-L-carnitine, and the comparison between GPC and acetyl-L-carnitine, they both work together and they have a synergistic effect. So both compounds, really what they do, they support increased production of the acetylcholine. And you don't have to know what that is. Just know that more of it's better. We have the nutrients that allows your body to begin to make that. It's just really God, it is almost a miracle. I can tell a huge difference when I take it versus when I don't take it. So I try to get a double dose.
Yeah, we're blessed to have that product. That's something I hope we always get to keep. I hope it stays in the natural field forever. But for those of you out there that don't really know where to start, I know we've given you a whole lot of information. Go to our website, greenwisdomhealth.com, fill out the health survey, because we do lab here. If you're new to our show, we run it we can order it anywhere in the United States, basically, and figure out what's going on so you know your vitamin D levels, which is actually another thing to do with brain health, and you can see if you have cardiovascular issues. It's a good way to get started so that you're not guessing and you don't have to buy all kind of things and try it. We actually can tell you exactly what to take. And for those of you that are already on a lot of these things, we hope you have learned something today and retain the information based on the products we told you about. And Dr. Lewis, we always like to end our show with something that comes from your heart. So please share with us something of inspiration.
Well, you take a sip of coffee, I'll share with you, make you spit it. One of the things is that, these nutrients are really good, but it doesn't matter if you don't have the faith or you have a negative spirit. So what you have to do is you have to purposely put love and warmth in your emotions. You have to have appreciation. You have to give, and you have to have gratitude. Curiosity about what could become even better and better. It's all about focus. You have to have excitement and passion about something, and even if that's giving and making somebody smile, you have to have determination, because nothing ever happens until you have a dream first and foremost. Don't use the excuse of a bad habit, because a habit can be the best of servants or it can be the worst of a master. We ask that God bless you and keep you healthy. We really would like to, make a bigger splash to make this a healthier world, because your life matters. And if you get it healthier and happier, you're going to positively influence the people around you. And that's our goal.
That's right. You guys have a blessed week. We'll be here next time on the Green Wisdom Health Show.
Once again, our show has come to an end, but your hope in your health is only beginning. If you or a loved one are in need of a different outcome and are waiting for a brighter future, take the first step and go to our website and fill out the health survey. Please don't keep us a secret. If you know someone that could benefit from this podcast, please share this show with your friends and family. You are only one step away from a life worth living.